Welcome back to Clinic Annex with Dr. Bosede Adegbite. On request, I'll be discussing the differences between cardiac arrest, heart attack, and heart failure. These are heart conditions, but people mistake them one for another. But if you know what they are and what the person experiencing this condition needs, you might just be able to help them to survive. Yes. So what are the differences? Let us start with cardiac arrest. Cardiac arrest is an electrical problem of the heart. When you do electrocardiogram, what we call ECG, you will see tracings on the paper. And the tracings are regular, they are expected, the pattern is usually expected. But when there is an electrical problem, you see deviations from normal. And when the heart stops completely, then you see that the tracing is flat. So what happens in cardiac arrest is that the electrical activities stop and then the heart suddenly stops working. So the person drops and becomes unresponsive or unconscious. When you check their pulse, there is no pulse. It is an emergency because that heart needs to pump again if that person will leave. So you can jumpstart the heart. It is like a vehicle that has battery problem. You can jumpstart that vehicle. So you have 4 minutes to jumpstart that heart. And you jumpstart the heart with cardiopulmonary resuscitation or with an AED, automated external defibrillator. Anybody can use it because it tells you what to do. It will prompt you, do this, do that, and so you can use it. So it is advisable that organizations, schools, train stations, banks, workplaces, religious organizations have AEDs so that just in case somebody needs it, you can quickly jumpstart their heart. And the most important thing, by the way, is giving them a cardiac massage. So even when you are not trained, just make sure that you are giving them compressions, chest compressions. These chest compressions can nudge the heart back to functionality. It can help the heart to remember that it needs to pump. Yes. So if all you can do is cardiac compressions, yes, it is the most important part of the CPR. Please start immediately. Now, what about heart attack? Heart attack, on the other hand, is not an electrical problem. It is like a plumbing or fuel problem. So in heart attack, there is no adequate blood flow to a part of the heart. Maybe because one of the vessels has been blocked or it is going into spasm. It is possible that the vessel is going into spasm or there is outright blockage by a plaque. Plaques are formed by excess cholesterol in the blood. So when there is breakage of the plaque and it blocks the vessels, there will be blood clots around it, and then the vessel can be completely blocked, so no blood is able to flow, and then that part that is not getting blood dies off. Before it dies off, it starts complaining, oh, I need oxygen, oh, I need oxygen. So a chest pain might just be a warning sign. The person might also have dizziness or shortness of breath. They might have palpitations. That's being aware of their heartbeat. These are some of the symptoms that the person might have experienced. But if the person ignores these symptoms, then when the heart attack comes, what it means is that the blood supply has been completely cut off. Let's now go back to our vehicle illustration. If you no longer have fuel in your vehicle, will you be able to jumpstart the vehicle? What do you think the vehicle needs? Fuel. If it must move again, then you must put fuel. Otherwise, it will not work. So the same way with heart attack. A person having heart attack, what they need is restoration of blood flow to the heart, to that part of the heart. And it is an emergency. That part of the heart that is affected and dies off will not be able to pump. So the pump, other parts are trying to pump, but this part is not able to pump. And so the heart cannot pump effectively. And ultimately, sometimes the person may have a cardiac arrest. And that's because that part where the electrical activity starts from in the heart may also be affected by lack of oxygen. It is important to know that the most important thing for them is restoration of blood flow to the heart, which you should head to the hospital, the nearest hospital for. Yes, because you need to do that as soon as possible. But if they lose consciousness, then you will also need to start a CPR or use an AED. Now, let's talk about the last one, heart failure. For heart failure, it is usually a chronic problem. It has a long onset. It doesn't usually start acutely, like suddenly, although it can, but most of the time it starts over time. So in heart failure, the heart is overworked over a long time. Let's illustrate with hypertension. If a person has high blood pressure and they are not managing it, they are not controlling it, and the heart is pumping so forcefully, because the pressure is not in the heart, the pressure is in the blood vessels. They are kind of tight and do not allow free flow of blood. When this happens, the heart is determined to pump blood, and so it will be pumping with high force against the high pressure, and it will do that for months and years. After a while, the heart will now be tired. When the heart is tired, the heart is not able to pump as much as it used to, or as much as the body needs or the person needs. So it is like saying, you cannot come and kill me, I'm tired. So it will pump a little per time. Imagine if the heart is supposed to pump 70 mils per time, and it is now pumping 20 mils or 40 mils. Definitely that is not adequate for the person. So that person will now begin to have retention of fluid, so they can gain weight. Not a healthy weight gain, but you will see them retaining fluid. They'll be bloated. Their legs will be swollen. They'll be getting tired. They'll be coughing. They might be coughing because their lungs are also congested. And then they cannot walk a short distance without resting. They must rest because they don't have enough oxygen. The heart is not pumping well. And that is heart failure. So when a person has heart failure, they need to see a doctor. Because if they are not taken care of, then that heart will stop working at some point and say, I can't kill myself, it will stop working. But before it gets there, see a doctor so that that person can be properly treated. That is the difference. I hope it's clear. Cardiac arrest jumpstarts the heart immediately. You have 4 minutes to do that. And you are likely to succeed at it. You are likely to be able to help the person reverse the condition if you start right and you do it right. Heart attack, do not ignore the warning signs, because definitely it will give you warning signs. Never ignore these warning signs. Please go to the hospital so that it will not get to the end stage where you cannot reverse it, and then you ultimately also have a cardiac arrest. And heart failure is usually not an acute problem, it's a chronic problem, so don't allow it to even start, because if you have a heart condition and you manage it well, you are not likely to get to the stage of heart failure. So I hope it helps, and I hope it is clear. Please share with everyone you know, so that together we can save lives. And please remember, good health is great wealth. We will always do what we can to protect ourselves, God helping us. Next week, God willing, I'll see you again with yet another topic. And I promise, in one of my videos, I'll let you know what to do when a person loses consciousness. Until then, please take care of yourselves. I'll see you again. Bye.